Everybody, oh yeah, yeah, yeah. See a bunga, see a bunga. He is my provider. My back, my back, my back. The most I have my.
Hey, what's up? Welcome to the ride. Welcome to the ride. Yeah, man. Ride along for today. It's Tuesday. Aren't you happy to be back? Yeah. Back from where, right? From the big blackout from yesterday. Guys don't remember? Yeah, we back. Welcome back, and I'm happy to be back, guys. Happy to see such beautiful faces. Wendy Charles. I mean, I ain't seen your face, but I know what you look like. Wendy Maguire, big up yourself. Good evening to you, Wendy. Wendy's, Kevin Maras.
If you're not satisfied, go back on.
How you doing?
So when I woke up,
hey, big up yourself. Guys, today we're having an engagement, a conversation that includes you, myself, Mr. Gerry Hopkins, and Mr. Ron Redhead. This is a conversation. So get ready, because we open up the phone and I want to get your reaction to this. Very important conversation, guys. Very important conversation. All right? Hey, Cecile, how you doing? Everybody share, everybody share, everybody share, share. Let me share as well, guys. Let me share. And listen, we ain't spending a lot of time at the top. I want to share the program. I want to get it started because there are so much things to discuss. There are so much things to discuss, Cynthia. Cynthia, you know that, right? There are so much things to discuss.
I feel like beat my chest. I feel like beat.
There are so many things that we need to discuss, man. Yeah.
Beat my chest. I feel like beat my chest. Yo, I sing it. See a bunga. See a bunga.
I share.
Everybody, oh yeah. See a bunga.
Everybody hit, say, everybody share the program and say, I share. Everybody share the program and say, I share. Yeah, share it here. I feel like beat my chest. I'm blessed. When I woke up this morning, I got reasons to show. Hey, Charmaine, how you doing?
I woke up this morning.
Big up yourself.
To show.
Alright, guys, alright. Also, I gotta big up my friends and followers on our YouTube channel. Big up the folks on YouTube. Thank you so much, YouTube. Yeah, big up the folks on YouTube. Thanks for locking it down today, guys. Let me share one last, and then I'll tell you. I'm coming. TNT. There we go. All right, guys. All right. So earlier today, right, we had a post-cabinet meeting, and the Prime Minister gave an announcement, right? There were a few changes, alternation to the protocols that previously existed, and we're going to talk about it because it impacts people in many different ways, right? And also, I want to hear from the people on the ground in Grenada who actually feeling the impacts, or people who know family members in Grenada that are feeling the impacts of these protocols, right? Before I bring on my guests, I want to show a clip of the new protocols that's changed, the new things that have changed and will change as a result. So take a look at it, guys, and when we come back, we'll talk about it with Ron Redhead and Mr. Gerry Hopkins. Check this out.
Effective October 5th and continuing until October 19th, the nightly curfew will continue, but will be adjusted from 7 p.m. to 4 a.m., not 5 a.m. as done before. The no movement weekends will be discontinued. This measure has certainly helped to curb the rate of infection, but health experts have continuously indicated that we must learn to live with COVID-19. Therefore, it is imperative that we seek to resume a degree of normalcy as much as is possible, while continuing to safeguard all our people. Retail stores across the country will now be allowed to resume normal operations, but we encourage store managers to maintain 50% capacity in the store at all times as a maximum, and ensure that workers and patrons alike are following the recommended protocols. These are proper wearing of masks, appropriate physical distancing, avoiding large gatherings, and regular hand sanitization. Beaches will be accessible for an extended period between 4 a.m. and 4 p.m. daily. In the food service sector, dine-in services will resume for fully vaccinated persons only. Gyms and fitness centers are also permitted to resume operation. Likewise, daycare centers and businesses in the beauty sector, including hairdresser salons and barbershops. However, there is one caveat, which is based on consultation with representatives in the private sector to help facilitate continuity of operations in the event of future spikes that could otherwise force another shutdown of operations. Let us all avoid this. Having consulted also with stakeholders in the following industries and acting on the general recommendation, employees in the food service, accommodation, fitness, beauty, child and elderly care sectors must be fully vaccinated, or in cases where they have received only one dose, the second dose must be administered within specific period after the resumption of operations.
All right, and thanks to Party Grenada for that excerpt from that speech there with the Prime Minister. We're now joined now with Ron Redhead and Mr. Gerry Hopkins to discuss this, put it into perspective, and try to understand a little bit more as to the ramifications of these new protocols. First, Mr. Ron Redhead, so how are you doing?
Well, not too bad, Junior. Just good for the time.
Nice, nice, nice. And you're on the ground in Grenada, so it's good to get your perspective from that point of view. Mr. Gerry Hopkins, how you doing, sir?
Fine, thanks, Junior, and hello to you, Ron, and to all of your viewers and listeners. Pleasant good evening.
And we also have to say hi to the folks over there on YouTube. We have a very large following on YouTube, and also we're live on J Wonder 107.9 FM in Brooklyn, New York. So we're pretty much covered getting the word out. So you guys, if you're family out there, make sure you shout out your family that's watching and listening around the world. So Ron, let me start with you. You're on the ground. You got a chance to see the Prime Minister's speech earlier today. Your initial reaction?
Well, some of the changes were not totally unexpected in the sense that people saw the numbers being reduced, and we welcome that good news. But I think overall the concern for many Grenadians at present, COVID-19 in particular, is specific to the amount of deaths that are occurring. So, for example, the no movement days, the removal of that on the weekends, that was welcome. I can say this for a fact. The opening up of barber shops and hair salons, those businesses in that particular sector, that was also welcome. So the non-essentials, for example, some of the companies like Unicom or Codes Grenada Limited, they are going to start operating from tomorrow, God's will. That will augur well because it will help to kickstart some economic activity or re-inject life, so to speak. So those things are somewhat the initial reaction. But then again, Junior, I must say, on the other side to it, while we are focusing on COVID 19, a lot of people are concerned about the economy and what is going on there. So generally, people are listening to the COVID-19 situation, but they are also specifically concerned with the economy and the economic situation in the country.
Gerry Hopkins, sir, after looking at and hearing the Prime Minister remarks today, what's your initial take? What's your initial reaction?
Um, like Ron said, some of the things were expected, like easing up on the protocols with respect to the lockdown, the hours, lessening of the hours, allowing certain businesses to reopen. But I was really looking for something more significant in terms of how we're going to prevent another wave. And I wasn't hearing, I was hoping to hear something about what we're doing on the borders in terms of the quarantine period. That would be brought up to at the minimum 7 days for folks who come in with no with a negative with a negative PCR result, and at 14 days for those who test positive. I was also hoping to hear something about what we are going to be doing about isolating other cases that test positive as opposed to just sending them back home. I was hoping to hear that we have sourced funds and resources so that now we can ensure that folks who are quarantined for 14-day periods, especially those who are alone and are of low income, that they would be given special medicinal packages and care packages. So I didn't hear any of that. It was also promising to hear though that they are paying more attention is being given to having stimulus packages available for those who are in need of such. Uh, but we didn't hear much details on that. So I'm looking forward to hearing more about that and to seeing that this really does happen, because we really needed that a long time ago. And it's good that it's coming now. I commend the administration, the government for doing it now, although it should have been started a long time ago in earnest.
Yeah. Well, when I listen to it, I really try to look at it from both perspective, right? And Ron brought up a very good point earlier and say that there will be economic activities when courts and other businesses start to reopen. But my question is, what is it in place to ensure that that 800 or 700 number that is currently active, what is preventing that from creating another 700, 800 on top of that and creating a second or a third wave? Ron, do you have a sense as to what would prevent that from happening right now if all these things were to start back as normal?
Issue, because let me tell you this. My concern primarily is that I would like to see a more organized approach to the whole question of COVID 19 by setting up a separate unit from just the Ministry of Health, with managers, people with disaster management qualifications or background, and people who can organize resources to be able to mitigate against some of these things. So, for example, NADMA, setting up, getting SGU involved in that process, and separating the Ministry of Health from the day to day COVID 19 situation so that it can focus on some of the traditional concerns in terms of health that the country is concerned with. The Ministry of Health, right now, to be quite honest, is bogged down. A lot of people would not say it. This is a particular situation. And whenever we have spikes or cases that keep on increasing, is just one set of people that are seemingly responsible to help solve this thing. So I was very happy, for example, at the level of volunteers that came forward, both from SGU and abroad. That again, it augured well in terms of the whole fight and the resources, human capacity that was required. But I still believe that if we set up that separate unit and properly organize it, so the NADMA headquarters should be an area of main organizing where you're distributing resources. You're allocating resources and organizing the distribution of food packages. You are distributing, let's say, volunteers to different sites. So, for example, we no longer have the lockdown weekends. So, what I would like to see, those volunteers who can become involved, they should now be redistributed at the various community health centers in the community. So to make it more direct, or maybe they should be going out at least 3-4 hours morning time to find people at home, because that is an area of concern. So, as Brother Gerry said, I didn't really hear specifics as it relates to how are we going to prevent another spike in that nature, because you can't stop it. It's here and it's global. But how are we going to prevent another spike to occur in that nature and that magnitude? I didn't really hear some specifics and solid indications that government is leaning towards that direction. But it's there are some good news in between. Don't get me wrong, but I didn't hear some specifics where that was concerned.
Yeah, Gerry, brother Gerry, what do you think? As I asked earlier, what would prevent or possibly prevent, or what government could do, in your opinion, that you think could prevent another wave, whether that's the second wave or the third wave from occurring? What's stopping the 800 from not becoming another 800?
Well, there are a few things that can be done, and one for example, the frontline workers, the nurses. We know many of our nurses came down ill, sick with COVID-19. Nurses and other healthcare workers. We already have a depleted number of nurses, and that the fact that they got ill, and we had not enough people to replace them meant that the care of folks who are in the hospitals there with other conditions, as well as those there with COVID-19 symptoms, it meant that they were not being taken care of adequately. So I'm concerned that I didn't hear anything for what would we do with nurses, for example, when they come down with COVID-19. Do we have special housing for them? For example, here in New York, nurses and other frontline workers were allowed to stay in hotels away from the rest of their families to prevent the spread of the disease, the virus. I didn't hear anything like that, and I'm hoping there would be such considerations. I also didn't hear anything about whether or not we are sourcing additional adequate PPP, protective gear, enough, the suits that you wear, the mask, the coverage for the head and the hands and everything else that we know what have been lacking in Grenada. I know folks here in the diaspora have been doing a lot to try to source that and send it back home. But I want to hear what government is doing with respect to that, and how they're organizing in that respect. All of those things, like I mentioned a while ago, what happens at the border, readjusting the policy in terms of quarantine period so that people don't slip in with undetected loads of the virus and then spread it with their families and others after 2 days of inadequate, senseless 2 days of quarantine. So there are all of those things help, and minimizing what we do with the bus drivers. How are we helping them to make sure that they're properly protecting their passengers and sanitizing their buses properly and protecting themselves as drivers in those buses? They're offering a public service, although they're privately operated with high bills to pay and lots of taxes and levies on the gasoline and other, there could be incentives there and adjustments made to the cost for bus drivers so that they could afford to take fewer people. If they have less to pay in the taxes on the gas and the other fees that they have to pay, or some kind of moratorium on the loans that they are repaying for the vehicles for a couple months, then they would be able to take fewer passengers and protect their passengers.
Yeah, I think, and I get what everyone is saying, and everyone is basically looking for something specific. Everyone wants something specific to meet their needs, and there are a lot of people. I mean, Grenada 100,000 people, but people have different needs. But I'm doubtful that everything could have been packaged into one statement. But what I'm happy about, right? What I'm mostly happy about to see, and that was announced, is that the numbers of positive infected people is dropped. Remember, just last week, that number was 2,000 something. Now it's down to 800, it might be 700 and something. But what is alarming with those numbers is that the death rate is, it dropped a little bit. 2 days ago there was 9 deaths. Yesterday there was 3 deaths, but there still are deaths within although the numbers are trickling down. So Ron, you on the ground, you get a sense as to what's happening. Why do you think that is happening where there are so many deaths, but yet the numbers of infected rate continue to drop? What's your take?
And I agree with you because the recovery so far rate of individuals, it has been positive. However, the deaths, and I get the sense when I listen to people who have been at the general hospital, for example, recovering from COVID-19, that there is anytime they go in and there's not an extreme situation ongoing, they are rushed to be removed because you hear the whole question. We don't have a lot of beds. You hear the whole question of medication, whether or not they have or is prescribing medication to people. We don't know the particular situation with that. We don't know if there is a shortage of any. We don't know specifically what are all of the patients being given in cases, because you have varying illnesses. Some would have pneumonia, others will have the general concern, but they are extreme. They may have oxygen or breathing challenges. So you have those concerns. My question is, as it relates to the deaths, are we doing any proper reviewing of the procedures and maybe the measures that are being used at the general hospital to ascertain whether or not the mistake is only as a result of people coming in for late treatment? And then the question, Junior, should be, if people are coming in late, how do we correct that? Should we be going to people to prevent that situation from happening? So I am not getting that sense, and I am a bit concerned that we are not properly reviewing. We need to determine, for example, whether or not we have a situation of too much people being at the facilities at one given time and not enough is out at the communities. So again, an assessment will help us to analyze that situation and be able to redeploy people wherever we can. So far, I can say that the authorities have made it clear that the majority of the deaths that have occurred are as a result of people coming in for treatment late. Now, if that is the case, you have a particular situation where I believe enough is not being done to go to people where testing is concerned, and even the whole question of vaccination. I would like to see more home visits. I know the staff, they are pressed and they are challenged. We have budget upcoming, so I would like to see some sufficient resources allocated to help increase that particular situation.
Yeah,
Uh, Junior,
yeah,
on that topic, I am very concerned, and I would like some clarification and some more details and transparency on the numbers. We see a drop in infection rate, but I want to know how many people have been tested. What's the number of people that have been tested around the country compared to the number that were being tested when the rates were high? Are we testing as many people or less? If we are testing fewer than we were when we had very high rates of infection being reported, then the numbers we are seeing now are not really telling us too much. It's not really an accurate assessment of the current situation.
well,
The
Jerry,
other thing,
to
the other thing, the other,
before you go on, hold on to that point right there, because that's a very good point that you brought, right? What is the rate of testing versus the rate of positivity? And I think that we need to clarify and understand how the positivity rate is calculated. But I'm getting the feeling that there are much more tests going on because much more people are going out to be tested. So you would imagine that if the positivity rate was increasing, the rate of infection should have increased as well.
yeah, but Junior, I don't want to go on feelings. I want to see the accurate numbers. I want to see the actual numbers. How many people, for example, in the last 3 days, how many people were tested compared to a 3 day period when the infection rate was very high? I want to see that kind of data. The other thing I would like to see and hear is Grenada still is, in the OECS countries in particular, amongst the lowest in terms of our recovery rate. More people are dying as a result of COVID-19 than elsewhere. Even St. Vincent, uh, an island which not too long ago had an eruption of a volcano under stress, has 3 variants on the ground recorded and reported, and still only had, up to a few days ago, only 19 or 20 people dead. Really, a similar population around 110,000.
I think it was 20 something. I think it was 20 something, Gerry.
So it has gone up to 20 something, but I'm going from about 4 days ago. So they have 20 something, and we have what, over 160 or thereabout. So the recovery rate is still dramatically lower in Grenada than elsewhere in countries that are similarly placed in terms of population and other factors. So I think we need to do a better job with isolation, a better job with treatment, a better job with providing folks with PPP, protective gear, a better job with managing the cases before we find out that they are ill and after. I mean, and sending people back home, I just can't get over that. We have something better than that.
Grimes said something earlier that I want to outline as well. Brian Grimes said that he believed that the no movement weekend actually worked. Now, the no movement weekend is something that was also implemented in Jamaica. I know we have a lot of Jamaican friends watching over there on the YouTube channel. The no lockdown weekend was implemented in Jamaica as well. And it was, I think, going into the last week or so, was the second or third week of the no lockdown weekend. Folks are saying that yes, that in fact the no weekend movement was actually working. Do you think that Ron, you're on the ground, do you think that government kind of moved too fast? Because you cannot calculate the actual progress of something like a no movement weekend or any kind of curfew not until 2 weeks or so afterwards. It's not an immediate effect. You don't put it in and then tomorrow the numbers drop. You have to look like 2 weeks into the future. Did they move a little bit too fast, or you think they're moving a little bit too quickly?
I think there is a sudden rush. The question is for what? I don't know. But I would say that leaning on Brother Gerry's position, if you do not have a true picture, because we just start to get data in terms of testing Grenadians, we really just start to get data on the ground. So if you don't have a true picture, even though you are seeing positive signs as a reduction in the numbers, would it not have been better to say that you're going to remove one day, so Saturday, for example, but leave the Sunday intact because it is working, it is bringing results, and you need to get more data. So you're going to organize around the country again another rounds of the mobile testing units or the pop-up clinics, etc. Because that, to me, and this is why I was making the point, why I believe we need a separate unit from just the day-to-day Ministry of Health running COVID-19 situation in Grenada. That to me makes more sense when people go to the community and they are provided with the opportunity to get tested and to be vaccinated. That is more effective than just setting up the ordinary structure that exists during the week. It's not effective. So I would have looked at maybe just removing the Saturday, getting vendors, for example, to go out and ply their trade because they need to pay their bills, etc. Market vendors. On Saturdays, that's when grocery and town is busy with people, etc. I would have removed the Saturday, of course, keeping
But Sundays are no movement weekend anyway. Nobody
but
do.
generally, but where the movement will take place is at the restaurants, at the bars, and so on. Down in the south and so on of the island. So,
Right.
I think you needed to cut that out because there is a correlation between that kind of venture and high rates of COVID-19. So all I'm saying is I would have looked at maybe chopping one day, keeping
Right.
it, because as you said, it's working. So why
Yeah.
you gonna try and get rid of something if it's working?
Let's jump on the phone line real quick. We have someone on the phone line. Call your live. Where you calling us from?
I'm calling you from New York.
Go right ahead, New York.
Yeah, Mr. Redhead, you're a little bit in the dark. I'm not sure why, but Junior, thanks very much for bringing on this guest and then.
Yeah. My phone line just closed by itself. Caller, I apologize for that. I'm opening back the phone line so you could call us back. Apologize. Again, the number is 718-701-5720. This is your conversation, guys. we're talking about the earlier today, the Prime Minister of Grenada came out and he made a statement and relaxed some of the protocols that was engaged. Some people say that it was too soon to do that. Some people saying, well, it's just about time. Some people even think that he didn't go far enough. So there's a balance, there is a kind of balance dance that you have to do. And so we're discussing it, and we want to also find out how has these protocols affected you, whether as a small business owner, whether as an individual. Let's know how it affected you. So caller, thanks for calling us back. The phone line just closed for some reason, but we're glad that you called back and you could finish your point. So go right ahead.
Yes, I heard Mr. Redhead making a point that, or Mr. Hopkin making a point about PPE. At no time at all in the diaspora we ever heard that there was a lack of PPE among healthcare practitioners in Grenada. And I don't know where he gets his information from. Probably he could verify that to us because we are listening and we want facts. Right. This evening is not about blaming. It's not about whatever it is. We want to be objective. We want to find solutions to the problem. We had a problem on our hand a few weeks ago. We don't need the blaming and we do not need the politics. Please leave out the politics from this evening program. Let us keep it strictly positive so we can all learn something and come away with something positive that we can share and say we are at least crossing the bridge from where we were 3 weeks ago. The other thing about testing. Testing is more or less done every 2 weeks as required by CDC. Every 2 weeks is valid to do a test. So if persons were tested and they were negative, there is no way that they need to be tested again, excepting that they was exposed or feeling some sign of symptoms. When you give other persons who are not tested the time to go out there and get themselves tested to know what the positions are, whether they are asymptomatic and carrying the virus, and so on. And then he also, one of them also spoke on the mandate about the restaurants and bars and so on and being vaccinated. It's a very good thing to be vaccinated if you're going into those places because, first of all, you have persons who are preparing food for people, you have persons interacting with persons, and we know definitely there are a lot of persons who do not want to be vaccinated for whatever reason. And the only way to really come out of that, Junior, you are vaccinated yourself and you see what is happening in New York. If you have a certain percentage being vaccinated, definitely we know that you build what you call herd immunity, or it's a way of preventing a lot of us from going on to get sick, get on the ventilator, and eventually die. And as one of your panelists said, that the health facilities or the healthcare persons were stating that most persons who died came in too late because probably they don't know how to monitor themselves. They don't know what the signs are. People probably
or maybe they're just scared to go to the hospital.
Exactly. A lot of persons are very scared, and some people feel definitely, if they go there, they will be dead. They have preconceived notions that when they get there, they will be dead, and eventually what happens to them is mind over matter and everything. It's just a lot of persons are afraid of taking the vaccine, saying that they're going to get a lot of bad side effects. Definitely, if you go with that notion, because, Junior, when I went to get that vaccine, I'm telling you, there was a young lady there actually shaking because she was afraid of getting sick. And I had to say to her, listen to me, young lady, if you think that you're going to get sick, you're going to get sick. She came out from inside after the 15 minutes crying, shaking, like she was so traumatized. For what reason? Because somebody would have given her information, telling her, and misinformation is very, very bad for some people.
Yeah.
So I think they're doing a great job. We need to employ persons on the field, outreach persons. Ron talked about getting the other agencies. I think some of these, apart from the Ministry of Health is the first hand for information. And if you want valid information, you get it from the Ministry of Health. I do not see, if you're having an outfit, the outfit must be closely monitored to prevent corruption, because we do not want that. We do not want that in Grenada at this time, in particular.
Thank you, caller. Thank you, caller. Let's give the panelists an opportunity to respond to everything that was said here. One comment that caught my attention there, again from Brian Grimes. Ashida, how you doing? Brian Grimes made a comment. Hold on, I just lost it. Okay, he said, yes, there was. I am the president of the Public Workers Union, and I can attest to the shortage of PPEs. The government has even thanked the diaspora for donating and filling the gap of PPE. So leave Gerry Hopkins alone. He's making plenty sense. Gerry, a vote of
Junior,
confidence to you there.
Junior, let me also add to it. So I do not know on which planet this scholar exists or lives, but I have nurses, friends from Maribor and the General Hospital, and I'm sure I haven't heard from any in Carriacou, but I'm sure they have a similar problem because they always have a shortage in Carriacou. Who are claiming that they have to reuse PPE, gloves, and so on patients because they don't have enough to change from one patient to another. In some situations. So this person was talking about politics. We are talking about facts. We are talking about the facts. That's all we are talking about. The facts as they exist on the ground in terms of what is. This is not the politics. Yes, is the science and the art of allocating resources, determining who gets what. That's what politicians and elected officials do. We are not here. We are speaking of the situation as it currently exists in Grenada. So call it what you may call it. It is what it is.
Yeah, yeah. Again, guys, 718-701-5720. Giving you an opportunity to chime in. Let your voice be heard on this particular topic. Again, the Prime Minister earlier made a statement talking about the change of certain protocols and some addition to other protocols. Let's jump to the phone lines on the WhatsApp and hear this caller. Caller, you live? Where are you calling us from?
Yes, sir. Good morning. Sorry, good night. Calling from Grenada.
Grenada, go right ahead.
Yes, so just two issues, right? The first thing is we finally got the statistics on the total number of cases and the age group in which the majority of the deaths were, right? The majority of them exactly 130 were senior citizens. So giving them the benefit of the doubt, that's about 60 and up, right? So with that, it seems like more should be done for our elderly population. Because as we all know, the vast majority of people, let's say from 25 go down there, their chances of surviving COVID is almost 100%. All statistics show that throughout the vast majority of countries. So, and the vast majority of people in almost every country are over 60, the vast majority of deaths. So with that, I believe that a targeted approach towards our elderly should be given. And I have not seen that up to this day.
Yes.
Up to this point, I haven't seen that.
Caller, you make a very, very, very good point. And a point that is even echoed multiple times on this program. I think everyone on the panel could agree with you. Prioritizing the elderly. That's exactly what they did in New York. That's exactly what they did. The most vulnerable population are the elderly. So why not prioritize them in terms of vaccination and other preventative prophylactic measures?
Yes, and just one more thing, because I'm speaking of targeting them. Like for instance, the thing with them closing the beach off at 10 a.m. They brought it to 1 a.m. I know they're bringing it to 1 p.m. I know they're bringing it to 4 p.m. I mean, that is so, not part of the issue, right? So that's the first one. And just the second one, it's a second minor point. They said that vaccines will not be mandatory. At this point, they can never say, they have essentially made a U-turn on their words. And that, in my opinion, we should not tolerate lies, right? We should not tolerate lies, we should not tolerate liars, and we should not tolerate backtrackers. That's my final statement on that.
Thank you so much, caller. We appreciate you. Ron, what do you have to say on that?
Yeah, well, the caller is absolutely correct, Junior. You see, the thing is, from inception, the whole question of vaccination should really have been a targeted campaign approach to the elderly and the people, as you have said, most vulnerable. So people with underlying conditions. And you know where they should start? You have statistics, data at the General Hospital to suggest people living with diabetes, whatever other issue in various parishes, you target that. So that when it came down to who received the vaccine, the message for the youth had to be different to the message for the elderly, simply because the elderly was a more vulnerable group or is a more vulnerable group than the youth. And that targeted approach could have worked. It still could work, in my view. It's not being done, and that is a challenge. The previous caller, to this particular caller, a well spoken young man, I must say, he mentioned about getting the different sectors involved. So he agrees with that. But Junior, I wonder if we are having sufficient engagement with the various sectors? Take, for example, the unions. Brian Grimes is there. Are we engaging the unions to fulfill that particular issue? Take, for example, specific, the teachers. We are hearing of mandatory vaccinations or seemingly that for students and teachers now. Are the teachers and maybe even the school body being engaged sufficiently so that before you go into announce something, they are all on board or they have voiced their concerns with it so that what you announce is representative of collaborative discussion and dialogue and decision making as opposed to you just going and make the pronouncement. So I believe some of what was said generally by PM was rushed. And I think what should happen if we have made certain pronouncements, again, I keep calling for a review, Junior. We need, with the whole COVID 19 fight, an internal review. We cannot be looking at UK and Spain, what is happening there, to determine what sort of measures we employ. The Minister of Health and the Prime Minister have quoted very recently, they talk about football games and so on. That's for that particular area. But we are dealing with the Grenadian context. So I think a deeper sense of review because we don't have local data to make enough decisions. That is lacking still. And we need to consistently review. So, the last thing, when the caller spoke of being consistent, I would like some clarity on the government's position re mandatory vaccine.
All right, we sort of lost um, connection there with Ron. Ron, you back?
Right. Am I back?
You're back.
I
Back.
do.
You were
Yeah.
saying to
Right. Sorry
what?
about that. I do have a little challenge home here.
No
Yeah.
problem.
So you cannot say on one end, you don't support that, or you're not going to mandate vaccines, but on the other, you're saying, for example, for people to get into the restaurants, they must be fully vaccinated. The question is, I would ask, how would the food industry be equipped to identify, in terms of fake COVID 19 certificates? Did we have any sort of training engagement? Is that ongoing? Do we have any knowledge of that in that particular sector so that they could be able to prevent that? As we said, a possible spike could return, and we don't want that. So, enough engagement, in my view, is not being done to ascertain a kind of collaborative one voice, so to speak, on the whole fight for COVID 19. And I am concerned with that.
Absolutely right, Gerry. You could chime in there, but let me just make one quick point on the question of validity of your COVID-19 card that you have, right? So we have the CDC one here. I have one. I travel with it, by the way. So I went into a establishment, a school actually. My son was doing school hopping, and they wanted to present. They wanted us to present our vaccination card before we even get into the gate. And I just presented my card. The guy just looked at it and said, okay, go ahead. How we know that I was right? So it's not only Grenada that's facing that problem, you know. I think that is a universal problem, but Grenada could learn from it. So, Gerry, go ahead, make your point.
Yeah, Junior, I wanted to, I meant to say that from the very beginning, and I kind of slipped me, but I think we all would agree that the Ministry of Health and the government, Grenada, did a splendid job in the very early days when they were following the guidelines from the CDC and the World Health Organization, and they had very strict, policies in place at the border in terms of how many days would be quarantined and all of that. Now, when the vaccine came on stream, I think that they dropped the guard down a bit and assumed, based on the CDC word from the CDC also, that folks who take the vaccine, who come in here having taken the vaccine, would not be able to, first of all, wouldn't get it and wouldn't be able to spread it. But very soon, it wasn't too long into it that we found out that this is not the case. That even if you have a vaccine in your system, you may contract the disease and you may spread it. So there and then we should have changed the policy back to at a minimum a 7-day requirement and 14-day on the high end. Now, moving forward, what we see in terms of the engagement, I agree with Ron, it should have been more targeted, getting people to take the vaccine. But in addition to that, really and truly, government should have used, the Ministry of Health should have engaged, the other stakeholders more than they did. Folks who are respected in the community. I'm talking about the teachers, the sportsmen, the celebrity types, you may say, captains of teams and so on, the pastors, the doctors in the various communities, the nurses who live in a certain village, who people look to for guidance and who people would rely on, and whose suggestion or instruction people would pick or follow, an old school teacher or principal, they should have been brought in, in a Zoom or whatever, those community leaders, and brought up to date on have a script basically as to how to help in the messaging. If that was done, I could assure you the vaccination rates in Grenada would be much higher than it is, because everyone was looking to the Minister of Health, and many people saw him as being somewhat arrogant in the way he and condescending in the way he spoke to the people, to the masses, and that didn't help at all. So I for one, I believe I took the vaccine, but I'm not going to say that everyone must take it. I think it should be a choice that people make. And besides that, the argument for mandatory vaccine today is not the same as it was for other vaccines of old, the polio and the other vaccines. Those vaccines actually prevented you from getting the disease. They also prevented you from spreading the disease. So really, you can make the argument for mandatory vaccines, saying that those vaccines, if you do not take it, you put other people at risk because you can spread it to other people. However, what we have today is a situation where we have a vaccine that prevents you from having a worse off case of the infection, the virus. It basically, it's an individual thing. It helps you to maybe stay away from the hospital or prevent you from being so ill that you would die. And that's why I took it. I looked at the risk and the benefits, and I determined, based on the advice of my friends, my colleagues who are doctors and scientists, that is the better thing to do. And so I took it. However, to say that it's going to prevent other people from getting the disease or spreading infection, that is not a viable scientific argument, because you can have the vaccine and still contract COVID-19, and you can still pass it on. But it does help. And I still encourage people to take it, but we should get folks to help us do it. Spread the word.
You made a very valid point, Gerry, but one thing that I'm not supportive of, right? And I don't think is a good idea. When you talk about having celebrities and people of stature, other than medical professionals, come to tell you things about medical items or medical agenda items. For case in point, Gerry, if someone come up to you today or tomorrow and they do masonry work and they come into your house and try to tell you all about capping tree, how you could put wood on your house to fix it and make it look better, but he's a mason or he's a plumber, would you listen to him? Most likely.
Junior, what they are doing, they're not telling you, speaking of the validity of the science or the practice. What they are doing is saying, hey guys, it's believable. I took it too. I did it as well, and I think you should too. You see, the way society is, the way we learn and follow by example. We look up to people who we respect, and if you respect someone in your community and they're telling you that they did it and they have confidence in it, it's very likely that you would do likewise.
Yeah, that's but I think and I believe a better approach. Two mistakes. When I go say mistake, I would say oversights. Two oversights that was made here with the messaging for COVID-19 is one, the politicians feel like they could sell this vaccine. The politicians felt that they could use the bully pulpit and force people and say, you have to take it, you got to take it, you must take it. That was the initial approach, right?
That's part of the problem. You're right.
The politician became, because people just don't trust politicians. They always feel like you have an agenda. And when Steele came, he could be as genuine as possible in his heart. But a lot of people feel like he had an agenda. He quickly figured out later on that, this thing is kind of falling on deaf ears. If you check now, the messaging from the messenger is different. The messenger now is the medical practitioners, the nurses, the doctors, the press conference. Nicholas still not even walking to the press conference anymore. You have the doctors there, and they're the ones that send in the message. So my point is, from the beginning, Gerry, doctors is who's supposed to sell this vaccine. Doctors is who you go to when you're feeling sick. If your belly hurting you have a headache. They're the ones who's supposed to be on the front line of explaining to the patients that this is good or this is what it is. But a lot of doctors wasn't even on board with this. They're supposed to have more engagement with doctors. Let doctors and nurses and medical practitioners forget about celebrities, forget about politicians. They always think
Yeah,
that
I'm not.
anyway.
Junior, I would agree with you that we need the lead people should be the medical professionals, but we need to have community leaders because in the community, remember, a lot of the folks who live in the rural parts, they're not really paying attention to these public announcements. They listen to what happened in the village, what's been said on the ground where they live. That is what would convince them whether or not they do something. So we have to get community leaders as stakeholders to join in the process. And in the past, that's how it was done. For example, if you look back to the period of the revolution, when they wanted to get a message out to the people, they didn't just depend on the politicians saying it. They had people at the grassroots level taking the message to the people, and it worked. I mean, everywhere. You study what happened in in Germany, with Hitler. It wasn't just the public announcement from the bully pulpit of the politician. It was also what was happening at the grassroots level. So
Yeah.
you have to embrace and engage those who can have an impact, a positive impact, in getting the message across.
Absolutely, guys. We're taking your This is your conversation. We want you to participate. The number that you call if you want to chime in. To the folks, my Jamaican friends that's watching, you guys could chime in as well. I know that Jamaica had its share and have its share and continue to have its share. Probably a third wave of COVID-19. We're seeing the same set of apprehension from the Jamaican community, from the Vincentian community, where people are reluctant to take the vaccine because of how the politicians are sending out the message. They feel the population feel that they are not accepting the word from the politician. They don't trust the politician. Even Vibes Cartel, incarcerated artist Vibes Cartel, wrote on his Instagram that, listen, I don't know how Vibes Cartel is continuing to post on Instagram, but he did, right? Vibes Cartel posted on his Instagram and he said that, look, this should not be artists. He said artists are some of the dumbest people in the world. You want them to come up and talk about vaccine? Let artists perform. Let artists freaking sing. Let them entertain. Buju Banton didn't take lightly to that. Buju Banton came back and he hit Vibes Cartel. Well, listen, the whole sort of thing going on there in that community. But what I'm saying is exactly that. Artists, leave the artists, let they perform, let they sing, let they do their thing. They're not doctors. No, none of them haven't been into a lab. When last they been into a lab? They can't tell me nothing about my headache. Leave them, let they sing. Why you say I'm run?
Yeah, well, that is very interesting because some people share the view, as Gerry was saying, that you need community leaders to spread that message, but or not just community leaders, but the celebrities and the politicians. But the truth is, let's take for example when we had the whole issue of CCJ here. CCJ, in principle, was something very good, right?
Right.
It helps to improve the Caribbean unity and its institutions make them functional throughout the region.
It became
But
political.
precisely, and you see, had the lawyers or people of that background, judges and so on, spoken to the need for it, then it would have been more well received. Anytime, and I come from the school of thought, anytime you see politicians behind something, there is not always a good intent. It may be unfortunate because there are times that you have genuine politicians trying to advocate good things for the people, and it may not be received. But the connotation behind politicians is that they are generally not good because anytime you see they're doing things, they have some sinister motive,
Yeah,
etc. So
that's
you
every.
have that to grapple with. And we
Yeah,
had a direct example with CCJ. So I would have thought that looking at all of that situation, you get the people who know about the sickness to come and explain its impact on you directly, whether you have diabetes, whether you have a hypertension or some illness that can contribute to the worsening of the effects of COVID-19. Get them to talk to those people and encourage them to take the vaccine. And as Brother Gerry said, the community health facilities was a key area that you should have started. Remember, we did not have the vaccines and we got COVID 19 under control. The government was commended and should be commended for the effort that was done there by the not only them, but key stakeholders, the nurses, doctors, etc., who assisted. But they are overworked now. We have something that can help, which is the vaccine, and people have gotten somewhat complacent. That is the truth about it. The citizens got complacent, and also I believe the government got complacent when they relaxed some of the measures. So we need to review these things, but we need to also accept that messengers rather, should be the correct ones and not people who we're looking to score political mileage from and so on. Don't now is not the time for that.
No, it's not
Right?
a thing for politics.
Yeah,
You're,
yeah.
you're so accurately right. Let's jump to the phone lines right here. We got another call. Calling live. Where you calling us from?
Grenada.
Hey, so go right ahead, caller.
Yeah, good evening, Ron. Mr. Hopkin Jr.
Yes, sir.
Right. I'm a person, I believe in natural medicine, right?
Yes.
And from a scientific point of view, you are correct on your point. It's very, very correct.
Which point? Which point? Which point?
Point where you're saying the doctor should have come out in the beginning.
Right.
Right. But what is happening right now, the politicians and the doctors wipe out traditional medicine. And traditional medicine, there's many, if you look at India, how they're dealing with their problem, they focus on ivermectin and other drugs. In Africa and certain places, they're using ivermectin. Why it is the medical society is suppressing a drug that is helping people and fixing the problem? That is my question.
Well, that drug, if I stand corrected, is a drug that they say is people have been taking and dying from it.
Ivermectin, no. If you follow India, you could look up, Google India, how India bring down the Delta and what they did, and you'll see they use that. In Africa, if you check the stats on ivermectin, you'll see a straight line.
Yeah, no, listen. That's on the backdrop. We also must include that in the statement that India had hundreds and thousands of deaths before they even started trickle down. We had India hospital inundated with people. People couldn't get in. People was dying on the floor in front of the hospital. So it wasn't like a miracle cure and India just came back after 2 days. It was a terrible experience that India went through with the Delta.
Thank you. But I happened to listen to a lecture in one of the preferred, the area where most of the people are dying, and the head medical doctor, he said anytime somebody call him and say they have a cough or they're not feeling good, he immediately had packaged with ivermectin and the vitamins. He said drop that for them.
Yeah, but I cannot endorse that, caller. I cannot endorse that because I'm hearing that this is a drug used to deal with cows and horses. This is something that has not been proven to work and has been proven to be very harmful for human beings. So I cannot endorse that idea because I don't want someone to go and take that and then something happened to them and they say, well, right along was speaking about this and some kind of endorsement. I'm not endorsing that at all.
That is respected, but do your research on it and come back.
Okay, right. I'll check it out. But thank you so much, caller. We appreciate your input and appreciate you watching and supporting the program. Thank you so much.
Continue doing what you're doing, and we need that kind of mentorship out here. We need it.
Yes.
Okay. Thank you.
Thank you so much. Thank you so much, caller. Yeah, guys, we're hearing so much about alternative medicine. I'm not against alternative medicine. I'm very much supportive of all sorts of things in addition to boosting your immune system naturally, because that is what it is. Your immune system is the army, the soldier, the air traffic controller is the army, the Marine Corps of your body. They fight and kill infectious disease. So the idea is to build that immune system. Gerry, go right ahead.
That is a point I wanted to mention earlier, because I wanted to say that I was hoping the Prime Minister would have mentioned something about that too in his presentation today. I don't know if I missed it, but I can't remember hearing him say anything about the importance of eating healthy, having a proper diet, and boosting your immune system with the supplements and minerals that are known to help, the vitamin A, B, C, and D, and also the magnesium and the zinc.
Yeah.
And also, I can't remember hearing in the speech today anything about encouraging people to take the vaccine. I can't recall hearing anything about that. Maybe I missed it again, but if I missed it, I stand corrected. But what I would like to say, Junior, with respect to the caller who just came on there, you know, we have to take with a grain of salt theories like that or information like that. However, we have to objectively look at the data and see what's happening out there. It is true that in El Salvador, for example, they are using ivermectin on a large scale, and the reports from the government in El Salvador is that it's working. In India, especially a certain part of India where that was most hard hit, they have been using it, and they are saying that it's been working. We're also hearing that the people who are saying that it's horse and animal medicine are people who represent the big pharma, who are going to be hurt if a drug like ivermectin, which they have no rights to, becomes the big seller on the market, and they're not getting a share of it, because they want what they have made here in the US to be making the big bucks across the globe. So we have to look at all of it and look at it factually and objectively to determine what really works. I'm not saying here nor there. I'm not neither here nor there on this, but I think we need to take a second look at it to see why big pharma is coming out. And something that came out, this medication was initially not created for animals. It was not initially worked on and developed for animals. Later on, they found that it could also treat diseases in animals. But some in the US media would like to have you believe that it was initially created for animals. That is not factual. That is not the case.
Let's jump back to the phone lines right here, and then I'll give Ron an opportunity to voice his opinion and take on it. Caller, you live. Where are you calling us from?
Hey, good evening, Junior, and to your guests. I'm calling from Grenada.
Go right ahead, Grenada.
Gerry, you don't expect to hear the Prime Minister speak about boosting your immune system. Remember, the government partner with funeral homes to bring in these containers for dead bodies. I rest my case there. Thank you.
What caller? Okay, okay, all right. Let me just talk about this a little bit, right? Because there are a lot of contradictory information and some things that I think is taken somewhat out of context, right? As far as I understand with the funeral home situation, the funeral homes was basically taking a preemptive measures, because they know and understood that people are going to die. Grenada is not the only country where funeral homes stock up, have freezer trucks. I am somewhat in the business. I stream a lot for different funeral homes, and I got to see in the height of COVID, four of the 10 funeral homes that I work for, they had trucks outside of their homes. So that is, and all of them linked up. David Williams, who is a big funeral home here in New York, he linked up with Lacroix and all of them. So he would have probably even advised them as to what to happen. So I don't think it's government teaming up with funeral homes. It's basically funeral homes knowing what is happening and taking preemptive measures, because where they go stock up dead bodies. This is imminent. It's going to happen. You have 90-something, 100-something people in hospital. COVID-19 is raging. People will die, right? I saw the song like Nicola Steele. I'm sorry, but people, it was kind of...
But Junior, maybe the caller could have said it in a more nuanced way, but I think what he's getting at is this. Government had to work with the federal homes. I mean, they may have gotten concessions or whatever else, and maybe even gotten some... We do not know transparently how it was paid for, or if government paid a part of it. But that's besides the point. I think what that goes to is the fact that government did not do enough to try to save lives, enough to protect and prevent, and to have contingency plans in place to prevent what was always a possibility, what was always foreseeable. It wasn't a probability that we're going to have a case of community spread in Grenada. It was always a possibility. For 18 months, it was always a possibility. So why did we, along with having the refrigerators, why didn't we have a tent hospital? Why didn't we have isolation, housing areas around the country with equipment and ventilators and enough beds? Why didn't we have all those things to improve our recovery rate? That is the question.
Yeah, and that's true. That is the question. That is the big question. Ron, do you want to chime in?
Yes, and before I comment specific to that, I just wanted to reply to the caller earlier on who spoke of the alternative medicine, etc. And you see, Junior, for example, I have been following some of the official information, which are suggesting that there are going to be pills. There's even one a nasal spray
Yeah.
from something from a llama. These are going to be competing with the whole question of vaccinations. Remember, globally, we already have almost a rejection by the majority of countries and their populations
Yeah, but hold
for
on.
vaccination.
Don't forget your train of thought there. The Merck pill is not a prophylactic approach. It is not a prophylactic approach, so I don't see it competing with vaccination. The Merck concept, that pill you would take after you catch COVID in the early stage, that might prevent you from further hospitalization. So I don't know if it's competing items, because it's in two separate. One is before and one is after you catch it to help,
Right. Right,
right?
and you're correct. So maybe I should add some further clarity to say the competition will be in terms of what should I take, and should you now come and mandate the vaccines when I have already, let's say I didn't catch COVID-19 and I have already tried to, in a sense, immunize my own body from getting COVID-19. So I think that is a cause for concern. And what we need now is some long term planning to see how we can reduce some of the impacts these new options will have in terms of the fight against COVID 19. Not competing in the sense of should I take the vaccine versus tablets, but people are going to start to question what should I take? There are more options. Should I be leaning towards this? And should I now reject completely the vaccines, which I have concerns about? So that is something that we must look to down the road. I'm not suggesting that it should be incorporated in our speech because access, Dr. Martin, for example, made that point. Those are good news, but access to those bits and pieces will be key. The other point is, Junior, and we were speaking on the whole issue that Brother Gerry raised there. I just lost some of the trend of thought a little. I apologize about that. But
Lives,
generally,
lives, saving lives.
yes, saving lives. Generally, people felt that enough, or rather sufficient work between the 18 months that we had as a window was not done to develop the sector, or prevent the particular situation which unfolded very recently. This is why I believe if we had a separate unit, COVID 19 unit, or COVID 19 prevention and monitoring, whatever you want to call it, unit from the Ministry of Health, that may have helped us. So that unit, made up of different groupings, sectors, etc., would only have focused on preparations for that eventuality.
Yeah.
And for example, when it
Hmm.
came down to that question of the entry protocol, if we were looking at data in the way we should have been looking at it from other countries, we would have seen that people who are vaccinated, even before the August period and September period, but people who are vaccinated could spread COVID 19. So some sort of adjustment should have been had.
Right.
Again, that was not done. And that,
Valid
in
point.
my view, is a cause.
Valid point right there. We have a call on the line. Caller, stay on the line for a quick second. Let me just make this point right here. Even in first world nations, America, England, Canada, as much resources as that they have, and they have far more resources than Grenada and any Caribbean island, they could not have prevented this thing from damaging and ravishing their shores.
Correct.
So it's kind of in a situation where I don't know, even if they took the approach, their preventive approach, it would have come anyway. It would have reached the shores. They could have do whatever. You think America don't have spent millions and millions and billions of dollars throw money behind COVID, like money have no value. Anything they
Junior,
throw money at it, right? Hold on, Jerry. Before you go on to your point, let me just take this caller and then you're gonna make your point. But what I'm saying is, it's hard for our country to take any approach to have prevented what what is imminent to happen.
Yes.
Come to the caller. Caller, you live? Where are you calling us from?
Junior, good evening.
Hey, good evening, sir.
I wasn't going to call it program, but I heard your guest just said something that to me is kind of insulting. That he said that the government of Grenada did not do enough to save lives. For how many months? For 18 months, I watch and I listen and the government prepping and trying to educate people to get them to do the right thing. And to see what's happening now when they want to blame the government, what did you want the government to do? What else could the government have done other than hold the grown people's hands? And the only other thing I want to say about this, it saddens me. The fact of the matter is, the innocent people that are dying that has nothing to do with the behavior of some of these Grenadians that have become lawless. And they didn't listen. And they brought this mess to innocent people that were supposed to live up their lives in their homes, their golden years. They're dead because they never went out and played. No carnival, they never see no crowd. This is what they blame, or not blame, but this is what we look at other people and understand that we're becoming lawless. And for whatever reason, we don't listen anymore. We don't want to do the right thing. And now it hit us and we want to blame the government. It's not the government's fault. They did better than most countries of the world in protecting lives. That's my take on this. We need to stop blaming the government and look at ourselves and see what have we done wrong? What can we do? Why aren't we listening? Why are we not doing the right things? What happened to us? Why are we so lawless these days? What happened to Grenadians? What happened to us? This is the problem. It's not the government. We're grown people, and we have to give account for ourselves. Stop making excuses and listen to people that knows, and live for yourself. Quit falling other people, and let's protect the best asset, the people that gave us so much.
Right.
And for now, they're dying like this. It's not right, and we shouldn't blame the government, but we need to look at ourselves and our action. What did we do? And what we didn't do to help this situation and make it better. And even now, moving forward, what can we do in the midst of this to make it better? Stop looking at the government. Thank you, Junior.
Thank you so much, caller. We'll give you guys an opportunity to comment. I think, okay, yeah, we are. Caller, you there? Okay, we lost that caller. Yeah, Gerry, go right ahead.
Yeah, Junior. I'm going to address what this caller just said, but let me go to what you said a while ago. The whole issue of prevention. First of all, Junior, the US and England and the other great nations that failed miserably in the early days, they failed not because they did not have the means, not because they did not have the monies. They failed because they were not prepared, and they were doubting. Donald Trump, as president of America at the time, was doubting. He saw it as nothing. His friend with a similar hairstyle in England, he was doubting too. And many others, the ones who were not, like New Zealand, like Iceland, Singapore, and elsewhere, who took it seriously.
Canada wasn't doubting. Canada was hard. Canada was tough. Yeah, Canada was hard and Canada was tough. Canada wasn't doubting.
Yeah, let me just finish. So many who were doubting, and then the other thing was preparation. They had the means, but they were not prepared. They were not managing it properly. Just because you have the money, that doesn't mean that you can't manage it properly. I think we had the benefit of looking to see what the mistakes were of those who had it during those 18 months. We saw the best practices that worked. We could have looked at New Zealand, we could have looked at Iceland, even China, we could have looked at and learned a few lessons from them. And we have the Chinese in Grenada, they could have been helping us. We could have looked at what happened in South Korea and other places that worked and prepare ourselves for the inevitable. But we did not do that. So the other thing, the caller who just called, I think this caller sounded very much like the person who must not have been aware, must not be aware of what's actually happening in Grenada with respect to PPE. And here he is again, speaking of blame. First of all, I'm not blaming anyone. I'm just describing a situation. I'm just calling the facts, telling it as it is. What we have in Grenada is a situation where, yes, some locals, some residents did not take the protocols seriously enough. but we are talking about what the community spread we had, which came in from somewhere, and it came in because there were breaks in the system, because the borders were not well protected, and we were not prepared to deal with it when it happened. It was always inevitable. So I'm not saying that government did nothing. I'm saying that they did not do enough based on the facts, based on what we see, what we saw, and what we are still seeing.
All right, Gerry, hold on one second right there. We have a call coming from long distance. Let's take that call. You've been on hold for a little bit. Caller, you live. Where are you calling us from? Okay, caller, hold on a second. Let me up your microphone. Caller, go right ahead. Sorry for the long wait.
Yes, Junior. I'm calling back from Grenada. Junior,
Uh-huh.
I'm sure that I heard that caller called a few weeks ago and actually made the statement, the same statement he's actually blaming the jab. Junior, before the jab activities, the vaccinated people, a promoter held a $300 and something set for the vaccinated people. Junior, there were a lot of activities that the vaccinated people were allowed to have, and they were spreading this virus also.
Yeah.
Then after that, we saw a few
Caller, you there?
the United States on the so-called, I'm here, Junior.
Go ahead. Yeah.
Flying on Labor Day. Flying on Labor Day. You're not hearing them talk about that. You see, I believe his main problem is he does not want to come and quarantine for 7 or 10 days. The borders have to be controlled. That is why the virus came in here. He has a problem, and talking about the jab that spread the virus. Brother, please. There were activities before the jab, the Juve that we had here. So what are you talking about?
Yeah.
Thank you, Junior.
Thank you so much, caller. Hold on, guys. Let's jump to the WhatsApp. We have another caller on the WhatsApp. Caller, you live? Go right ahead.
Yes, good evening, Junior and listeners. This is our first time caller.
Hey.
I'm calling in response to the previous call. I'm not too sure your time lapse has passed, but I'm calling to deal with the gentleman that just called in relation to the blame being placed at the feet of the government.
Right.
No, we have to be honest and remember that Grenada was COVID-free for quite a long time.
Yes.
Based on the information that was given to the public by the authorities. Yes, the cases were 0 for months, and then we decided to open up the airport and allow the borders, in a sense, and allow the virus to become part of our society. So first of all, that decision has to take a level of responsibility. You cannot just sweep it under the carpet and say it happened because of the jab. No, in dealing and managing the COVID, as Gerry pointed out a while ago, we had 18 months to look at the international community to see how we could create our own defenses against the COVID virus, and we did nothing. So the spiraling of this virus in our society here falls, well, about 60% of the blame has to be at the feet of the government. The people we lapsed, in a sense, we allowed our guard to be dropped for a little bit. So we have to share the blame. It's not to say we're playing a blame game, but it is a problem that was created and it was fostered by another set of people.
Right.
So in long and short, every Grenadian have to take some level of responsibility. We cannot exempt the government because we support the party or we support their policies. The government have to take a level of responsibility for the deaths of the people here. Likewise, some of the Grenadian and our actions. Yeah. So you can't just blank it and say the government have nothing to do with it. And it's upsetting to hear grown individuals that appear to be intelligent coming on a public platform and making this sort of pronouncements.
Yeah. Yeah. Someone gave me an analogy the other day, right? Someone shared that analogy with me, and I had to kind of a little bit. They said to me, if for argument's sake, someone light a stick of matches, and they throw it on the ground, and then somebody passing, they see the stick of matches lighting on the ground, and they take a broomstick and light that broomstick from the stick of matches, and they go and blaze down a forest, and they burn down the forest. Who is the arsonist? Brother Ron, who is the arsonist?
An interesting analogy.
That analogy is not applicable in every respect.
It's not applicable. I'm not saying. I'm just saying someone gave me that analogy, and
it's interesting.
Yeah.
I would say it's interesting. But Junior, you see, and the caller is absolutely right. No, I want to reassure the gentleman who raised the original issue about playing the blame game. I am not going to play the blame game, and I have never tried to just simply play the blame game. But Junior, let us be real. The government or the authorities in this instance will have an obligation to ensure that our borders are protected, to ensure that the necessary equipment to fight COVID 19 is here, and that we have the current system, or the correct rather, system to be able to combat the impact of the Delta variant in particular.
Right.
So the citizens have the responsibility to support the efforts nationally and do whatever is necessary to help combat the spread when it gets here. In this instance, it got here. But what should happen is not immediately devise or develop this attitude towards criticism. Because you have to remember, if I am the authorities, I am in a position to receive criticism, critique, observations must be raised, etc., in terms of how I am dealing with the situation. And it is well placed. Do not
And you get
become
credit too.
intolerant of it. That is my message to individuals who are calling on that point. You cannot be intolerant to these criticisms because it's necessary for us to get the best effort out of this whole COVID 19 situation. That's one. Two, let me just say this, that how I see this whole scenario, which it unfolded. Junior, for example, let me be very frank, and we will treat it as an allegation because we don't want anybody to attack anyone and so on your platform. But I received information which suggested that in July, in particular, the month of July, when Grenadians were falling down in town and so on, that the Delta variant was here since then, right? So if we knew that, following that, you had the alleged Vanny Cowen voice note which circulated. Then you had the whole situation which unfolded. It seems to me that some level of responsibility must be, somebody has to be held accountable first and foremost as to why the Delta variant came in without us identifying that it was here. And then it got to the communities and it spread. We
Right.
knew of the fully vaccinated events, we knew of the jab, the unofficial jab which played. We are not blaming to say that that shouldn't happen and so on. The point is, it occurred. How are we dealing with it? Were we prepared? This is a well placed question which will be asked throughout the entire phase of this wave. Are we going to do more in future to prevent these spikes? Because we see in countries that have good vaccination rates, fully vaccination rates, they are also suffering from spikes here and there. The
Yes.
Delta variant is very transmissible. So you have that situation to deal with. So critiquing these gray areas is not going to serve as an attack on the administration, or should not serve as an attack on the administration, but should help us improve to prevent future occurrences of what we see here. Junior, let me tell you this, the death rate so far is 4 times more than we had in Hurricane Ivan. I think the total was about 39 deaths officially from Hurricane Ivan in 2004.
Yes.
And at present, it's about 162. It's well over 150.
That's
The
it's
point
great.
is, the point is, this was something that didn't come with any win. You couldn't predict it. So preparation had to be top notch. We cannot run from that. And what Gerry was saying, which is critical, it's not that these countries don't have the resources and can't combat it. That's why they are doing a better job generally, no. But our vulnerability with tourism, we had to reopen, for example. Look at
Mhm.
the cruise industry and in terms of how it has been prevalent among that grouping. So there are risks. So for us to do more in terms of preparation, we had to ensure that we did. So it's not, it's well placed, this critique in particular, and we must not be intolerant to it. That's what I want to say to the caller. Don't mind. I think it has to be fair. We have to be fair, Junior. We have to be balanced, right? You can't pretend and you can't be too political about these issues or partisan.
Right.
But the whole concern in terms of the loopholes, the gray areas, we must critique it because we need to improve it.
Absolutely. Jerry, I know you have a point. Then we jump to the phone line. Jerry, I come right back to you. Caller, go right ahead.
Hello, good evening.
Hey, good evening, caller. Where you calling us from?
I'm calling from New Jersey.
New Jersey. Go right ahead.
Junior, I'm listening to the program and there is a lot of ends and pieces trying to match up the situation that went on in Grenada. I was in Grenada when that whole breaking out of the Delta. Coming towards the carnival, I remember last year the government had closed down the country, right?
Mm-hmm.
What we had, what we call a community shutdown.
Mm-hmm.
Okay? So, in other words, you can leave from St. George's and go to St. David's, or you can come from St. David to St. George's. Everybody could have do whatever they have to do in their community. So, if we had any virus in the country, it would stay in that community where it is. People keep repeating about the jab. I was there.
Right.
I saw with my eyes of the people that were playing jab. I was in St. Mark, Gerry, Junior, and I look at all these little kids, 4 years, was jumping all over the place playing Veko and all these things. And which I thought, if was the virus, the whole community would have damaged.
Right.
Right? And my intake on this is nothing to do with the jab. Nothing. The situation of this thing is the people who come in from the diaspora, like all of us do.
Right.
And they came in, they had a 2 days quarantine, and they was let loose. Right? So nobody knows who had the virus, who don't, who carry not the virus. And what I see about that, in that situation, the government should say, let us repeat a community shutdown.
Right.
So if any action or activity was to go on in St. George's, it would stay in St. George's. If it's in Grenville, it would stay in Grenville. So whatever virus is roaming the air would not be spread to where it is.
Yeah, but it had to do that. It had to do that way because most people after the event finished, most people in town walk in Grenville. Some people in Grenville walk in town and they walk all over the place. So you can't contain it. Grenada itself is a community. It's a small island.
Right. And the buses, there was like shut jam.
Yeah.
So you don't know who carrying virus. People was not wearing masks. They was not following protocol.
Right.
And if they had do this community shutdown, we would not have the amount of death we have in Grenada at the moment.
Well, we
would not.
We could all do. I mean, I get your point, and I get your point, caller. Thank you so much. I want Gerry to comment on that. Caller, thank you so much. New Jersey, have a good evening. Okay. Thank you so much. Thank you so much.
Junior, I hear what that caller is saying, and I agree with her to a great extent. And what she's saying is that we should have had some form of a lockdown to keep it within the communities. But that would have been contradicting what the government was saying. Remember, the government kept saying, and we do not know whether or not that was accurate or the truth, but they were telling us that there's no COVID on island. Meanwhile, we are seeing all kind of strange things happening around the island. People drop in here, people drop in there. And then, of course, just after that, just before Carnival, we heard about cases of people who on the way out had the virus. But they, of course, went through the 2-day quarantine policy that was in place. So there are a lot of unanswered questions, and we've been there, we've seen what has happened. Let's learn from that. I trust that going forward, we will change the policy, bring it back to at least 7 days, have isolation, facilities put aside to house and take care of people who are known to be infected. Because basically the reason why the recovery rate is so low is because there's no treatment. Go home and self-isolate. That's it. Not enough. And our nurses and our doctors, we need to take better care of our nurses.
Hold on, Gerry. What other treatment they have for COVID?
Treatment as in the therapies that they have. They are therapies. I mean, they can learn. I mean, I leave it to the professionals, the doctors. They are
Yeah.
treating people in hospitals here in the US. They have therapies. They're giving them the supplements. They're giving them the minerals and the other medications. But from what I've heard in Grenada, 9 out of 10 cases, they're just told to go home.
Yeah, that's what they do here too. Gerry. There is no treatment for COVID. There are treatment for things that you develop when you have COVID. For instance, if you have pneumonia, they treat you for the pneumonia. But there's no
But
treatment
Junior,
give you for.
from what I've heard, even people who have underlying, because the people who get sick enough to want to seek help from the doctors are people who have underlying conditions. And we have a lot of those in Grenada. High blood pressure and diabetes are very, very prevalent in Grenada. So the people with underlying conditions who call for help, they have been told to stay home.
Yeah, I get your point. I get your point, Gerry. Valid point.
And they are the ones who are dying. The ones with underlying conditions, the older ones.
One of the problem why a lot of people in Grenada are dying, and that's my how I think. There are a lot of people in Grenada that don't even know that they have an underlying condition. A lot of people, they probably young in their 30s, in their 40s, and they don't know they have high blood pressure. They don't know they have hypertension. They don't know nothing like that. Some of them obese to the point where they feel okay on a regular day because Grenada don't have a culture of going to the doctor. They don't have a culture of going to the doctor, checking up themselves. And plus, you have a system where people drink a lot of alcohol, and that negatively affects your health. I mean, the consumption of a lot of sugar and all of these things negatively affect your health. So they need to develop a better culture of taking care of yourself. But to that point, let me jump to the caller on the WhatsApp. Caller, live, where you calling us from?
Yes, Grenada again.
Go ahead, Grenada.
So just to go off on the points that y'all were speaking of, in terms of the actual treatment, Dr. Donald, in maybe the last 4 weeks back, she mentioned all the treatments that they use at the hospitals. And while it did not include ivermectin, she did bring up hydroxychloroquine as well as vitamin B. Well, no, not vitamin B, vitamin zinc. She did not mention vitamin D. But so treatments have been brought up. Now, of course, there's no cure. There's no right cure for the disease, but there are treatments. Now, just barring ivermectin, we ain't going to talk about ivermectin, but hydroxychloroquine.
Hydroxychloroquine is worse. I don't want to talk. Hey, you mentioned that, Facebook blocking me. Don't say hydrochloro with the next screen.
HQC.
Okay, HQC. All right. I'm telling you, you don't like Right Along or what? You don't like the program?
No, sorry. You're right. But it's sad. It's sad though, because these are treatments that even our own doctors at our general hospital have admitted to using, but yet we can't say it on Facebook. So HQC. So that was one of the treatments that I brought up. But to your point as well, there are many Grenadians for real who do not take care of themselves and they think they're fine, but a lot of them have many underlying conditions, and that's what we've seen. The vast majority of people who died, one, they were over 60, but besides those over 60, the vast majority of those like 40 and younger had many different other underlying conditions. Like even the youngest of us who have died, the 18-year-old, she had underlying conditions.
Yeah.
So it's a big culture shift that we have to, I believe Grenadians have to focus on, shifting some of the things that they do, like especially with going for regular checkups, especially males, because I think the vast majority of it are males, so correct me if I'm wrong, but especially males, like going to the doctor, going for a checkup, there's nothing wrong with that. That's not being, feminine. That's not being female. But a lot of males, they might have that conception.
Yeah.
And not go to the doctor, not go for a checkup, and that could, be a life and death situation.
What Dai was saying, caller, and you're perfectly right, and it's true, and it shows statistically around the world that men are less likely to go to the doctor, to the hospital. So when they have an illness, some men, let me tell you, some men just wait until the thing fall out before they go to the doctor. No, they just wait. I was speaking to a gynecologist the other day, and she said, "Men, you're talking about why they think of fall out hanging a string," and they'll say, probably I should go and fix that. But it's, men need to. You see, there need to be a culture. I go to the doctor every 3 months. I go to the doctor every 3 months. But there are some people right now, ask them when last they've been to the doctor. They don't know if they have high blood pressure, low blood pressure, hypertension. They don't know what they have. They don't know what they have. They live their day just like nothing. Like they're just running on fumes and they don't even know.
Yes.
So that culture
Yes.
need to change, and specifically. But thanks
Yes.
for your input, call. I really appreciate that for calling in. And don't, yeah, go ahead. Yeah.
And Junior, that observation you just made again is another reason why we should be asking questions and encouraging and pressuring the government to do more in terms of preparation. Because knowing that these conditions, these underlying conditions, can lead to early death if you contract the virus, there should people who are known to be suffering with hypertension and diabetes and other similar conditions, asthma and so on, should have been encouraged very early on to take the vaccine.
Hey,
and also,
they don't know they have it.
Yeah, but no, I'm a part of what I'm saying is this, and also there should have been free testing for people from the very beginning. People had to pay for a test, so of course people are stunting, unemployed, jobs, businesses closed down. They don't have money to go and pay to take a PCR. So it wasn't until the thing hit the fan that they suddenly started allowing people to have free PCRs. So that was another reason why we allowed the thing to spread quietly, undetected on the island, on the tri-state area. I mean, on Grenada, Caribbean, PD, Martinique. So, Junior, we cannot get away from the fact that more had to be done. But looking ahead, I want to encourage those who are listening right now, those who are listening and can help to, besides pressuring the government and encouraging the government to take more precautionary measures and to plan better and to do more to save lives. I want folks to also donate. There are several people who are collecting, PPE, foodstuff, gloves, masks, headgear for nurses and doctors, all the things that the doctors and the nurses are asking for in Grenada. To that listener, again, let him know, doctors and nurses are asking for PPE in Grenada. So I'm encouraging folks who are listening to contact people out there who are doing it, and they can find a list. I'm sure RIDEALONG would have a list of the people who are doing that. I would have a list on my page through Gerry Hopkins, so that I could name a few now. We have John Crow is doing it. Lion, Rampoon Radio, they're doing it. We have Montgomery and Bernadette Hopkin Lions by Ants and Vivian James Vincent, they're doing it. There are people out there who are on social media who are collecting items and have already sent and are sending more to the doctors, to the nurses, and to community organizations that can directly distribute the stuff. With Rampoon Radio, we have Made in Grenada, Dexter Mitchell helping with that initiative on the ground in Grenada. And it's important that we don't politicize these activities, that it remains non-partisan, because we're doing it for Grenada, for Grenadians, and for the residents in Grenada.
Yeah,
and that's what we need to do.
Absolutely, and guys, it is true, right? That people out here in the diaspora, although we are faced with the same kind of pandemic that everybody's faced with, people are sacrificing their little earned dollar, because America don't have no trees and money don't falling down out of you go pick it. No, people working hard and sometimes in the cold. Right, and sometimes they work 2 jobs and they send on half of the money from the second job. So please, people, appreciate that, right? Appreciate the gesture, because people have to work hard. And I encourage, this is a venture. If you're gonna give from the goodness of your heart. It's not something that we're gonna give and then we go light up a thing over it and broadcast it out there. We're giving and we're supporting, and we're going to continue to do that.
Exactly.
If people who are receiving know that this is coming from a hard place. This is coming from a place where your insurance rate is high. Every time you drive down Linden Boulevard, you're getting 5-6 tickets. Sometimes it's $700 you have to pay. Gas, everything high here, but it's a sacrifice for everybody. So just appreciate it now. That's what we're saying. But we continue to ask folks to donate. And also, there are multiple things. I don't want to replicate what everybody is doing. So find out what are some of the other needs. If you know somebody is doing that, we don't all have to give hampers. You know what I mean? There are multiple things that are needed. So find out if somebody doing something you want to assist with that, assist with that. But I don't mean that you have to start up a venture shipping hampers as well and broadcast you doing hampers as well. Let us see, let us help from the goodness of our heart. It's not a promotional thing, it's not a stunt, it's not a broadcast. You know what I mean? We're giving because we want to see better for the people in Grenada, Carriacou, and Petit Martinique. Okay, we love you guys so much. And we care for you guys. Ron,
Mhm.
you've been on that for a little bit. I want to bring you back in.
Yes, well, I like to listen. I like to listen as well.
Yeah, man, yeah, man. But listen, I saw someone said something that's pretty interesting there. Yeah. Someone said something about the cure for COVID. At this point in time, I'm no doctor, but I have my good friend Wendy C. McGuire. She's a nurse practitioner. She helped me when I had COVID. I was on the phone with Wendy every 5 minutes. Every time my throat started to tingle, I called in Wendy, and that's how she saved me. I tell everybody, Wendy saved me, honest to God, because I was going freaking crazy. And every time I have a question, I'll call Wendy because she's a nurse practitioner. She would have seen everything. She herself had COVID-19, and based on she working in the hospital and she being with patients, when someone come in there and they're sick with COVID, even in America here, they'll tell you go home, take some vitamin C, get some vitamin D, get some zinc, and rest up by your house. There is no specific treatment at this point in time for COVID. If you have pneumonia, if you develop pneumonia, they'll treat you for pneumonia. If you have pre-existing condition that is affected because of the COVID, they'll treat you for that. But it's not like there's a pill that they could give you and that would just let your COVID go away. There's nothing like that, as far as I know. No, the Merck that we're talking about, the tablet that we spoke about earlier, they have a new tablet that's been tested. They say it was tested so good that they want to speed track it, right? And that's not a prophylactic approach. It's not like a vaccine. It's an approach where after you catch COVID, they give you that in the early stages, and it will help you not get the help from the virus from replicating in your body, right?
Right.
And I think that is a good approach. Everybody hoping and praying that this thing come off quick, because at least they think more people would take it, because when you're there in a hospital bed and you can't breathe, you just want anything to let the pain go away. People might quicker take that than the vaccine, and hopefully it work better, and people will have that would kind of drive us back to some kind of normalcy. So that's what I have to say on this. But let's do some closure now. Let's just come around the curve a little bit, guys. Gerry, let's close it up. Let's wrap it up. Let's put everything into perspective, Gerry, from your point of view.
Ron, go ahead of me, because I want to close. I want to mention something at the end too. I don't want to insert it yet.
Right. Okay. Go ahead, Ron.
Well, Junior, again, I empathize with all the families who lost their loved ones during this particular spike. It's never easy to lose a loved one, and the impact that can have could be very devastating on the family, especially when it's a breadwinner or a situation like that. So I want to empathize with all families who lost loved ones throughout this particular spike. I believe that we need greater reviews in terms of what we do. So, from protocols, from measures to treatment methods, we must always review that. We need greater data where COVID 19 is concerned in Grenada. Data is a problem historically in Grenada, and it is showing to prove to be a problem here as we fight COVID 19. So, for example, I believe we may need targeted interventions in certain communities where it may be prevalent. Dr. Martin, for example, I could quote from him, said very recently that what they are seeing is that households are spreading the virus greater, which means, in my view, you have a situation where at the community level, targeted interventions are required. And therefore, from a national standpoint, it's important to do what you're doing. But if you nip it in the bud in the communities early enough, you are going to find some positive or some more positive results where that is concerned. Lastly, to all the people donating stuff to Grenada, thank you very much from the bottom of my heart. I think that spirit of disaster and wanting to play a part is ever present and is always ever present in Grenada. People are going to put aside differences. I hope and pray that the spirit of collaboration can continue, not just from government and opposition side, but from government stakeholders, the unions, getting these people involved. And as we begin to have the discussion to reopen school, I believe, Junior, that we must focus primarily on ensuring that the environment at the school, in addition to all the talk about vaccines, because I just want to say this, I think you're going to have more resistance there as well. People are not going to vaccinate their children or give consent to that easily. So you need to ensure that the school environment is up to a standard. Whether or not we're going to only have Form 4 and Form 5 students at secondary schools,
All right, we lost connection there with Ron making his final thoughts on the reopening of schools because it's important. And my point of view is,
am I back? I do apologize. Am I
yeah,
back?
yes, you're back now.
Right, yes. So more engagement with the people should be had in terms of that, the key stakeholders, not just, meeting people for political mileage and such, but engaging the relevant bodies to ensure that you get maximum collaboration and cooperation where this thing is concerned. And I want to wish all Grenadians fighting in the trenches, those are the front lines, the nurses, the doctors, they have my solidarity and support. I know from first-hand experience, losing my dad to also saving my son's life, that there are nurses and doctors at the General Hospital who go above and beyond the call junior. And I want to give them the utmost respect and thanks today. And I think that we need to continue to support their efforts. And whatever assistance we can give, financial, human capacity, or human wise, I think we should do so. So we should
Absolutely.
continue in that cause.
Thank you. And I echo the sentiments as it relates to the families who have lost their loved ones. It's sad. I don't want to single out any particular family because every single loss is a devastating loss. But I too had a very close friend who died from COVID. And I know it hit the family very, very hard. A cultural ambassador for my village. It was definitely difficult to deal with it. And a lot of other people are feeling the same pain as that particular family. But we could empathize as much, we could give as much, but we cannot bring back life. We just have to live with it as it is for now and just be there for a family member who is going through a situation like that. So you guys have all of our support and all of our prayers. Gerry Hopkins, sir.
Yeah, Junior, I want to echo what you said about the importance that we don't all have to do the same thing. There are different needs out there, and recognize a couple of people who have recognized that. There's one individual in our community here in the diaspora from St. John's, Miss Yvonne Peters, and she, for example, saw the need to provide glucose monitors or devices that can measure blood sugar for individuals at home, and she has donated that. Some of it went down with Rampoon with their package, and she's doing some separately. And I encourage other folks out there to think outside the box and do stuff like that, because many of the people with underlying conditions need to identify and know that they have it, and it would be good for them to take those tests to find out what their blood sugar really amounts to, guided by the instructions in that package. Also, Junior, I want to recognize, the fact that there's a need for supplements and minerals, which are hard to find in Grenada, very expensive. And there is an organization here, Making a Difference Initiative, that have saw the need to do that. They comprise of registered nurse and a recording artist, Cheryl Vincent, Burgess McPhee Kwako, and Kristen Grant from St. John's, and myself. We have this organization called Making a Difference Initiative. We've been doing this for a while. This is about the third or fourth time we're doing a similar initiative. First time for COVID though, but the focus is on supplements. So if there's anyone who would like to donate supplements, to distribute to those in need in Grenada, to help to boost their immune systems, because we're talking about it, but we have to do something about it. So this is Making a Difference. And this organization is doing this in conjunction with After Work Networking Wednesdays, the monthly business professional networking event that I facilitate. So that's happening, and I want folks to know that they can contact me if they want to donate. I also want to thank you, Junior, for all the donations that you have been making. Sometimes you don't talk about it, other times you make mention, but I know you consistently help, and you've stepped it up, and you continue to help during this COVIDious times. And I thank you on behalf of all in the diaspora, all back home, for what you do with Ride Along. And I also want to say say that we commend the government for the good things that they have done, that we identified in this show, and I encourage the government to do more. Taking some cues from what we have discussed here in this show and has been discussed elsewhere. In closing, Junior, besides thanking you for having me on here as a guest, I also want to let folks in the diaspora know that I'm running for City Council in the 48th Councilmanic District. That is Flatbush, Ditmas, Midwood, Kensington, Lefferts Gardens, Lower Crown Heights, Prospects, Lefferts Gardens. And I'm doing this as an on-bought independent candidate. I'm a registered Democrat, but I'm running as an independent because I'm accountable to the people. And folks who want to know more about what I stand for and what my legislative agenda is, they can check out my page on Facebook, Hopkins for City Council, or give me a call at 347-350-4285. 347-350-4285. Everything is in there. I don't have to say any more here. But I just want folks to know that election day is November 2nd, and we need donations so that we can promote and really let folks know what this campaign is about on radio, TV, and print, and etc. So I would appreciate any support that can be given from those who are listening. Check out my page, Hopkins for City Council. Junior, again, thanks for staging this discussion. We need more like this, and I know you will continue doing it. God bless everyone.
Absolutely. Thank you, Gerry. Thank you, brother Ron. We're going to do this again. Appreciate it. Yeah.
I feel like beat my chest.
Yeah, thanks to brother Ron, brother Gerry Hopkins. Gerry, for City Council. Remember, the election is on the 20th, is in November the 2nd. Support November the 2nd. Yeah. More information, we're gonna have that on our page. You can link to Gerry Hopkins. He's on-bought independent candidate for City Council. All right, more information on that on the Ride Along page. Thank you guys for watching and supporting. Guys, listen. Let me put all of this into perspective, right? We are living in some serious times, and we all could agree. Things are not normal as we know it to be, right? But I firmly believe that on the other side of this will be a better people, will be a more loving, caring people, will be a people who actually recognize. Besides the fact, as I said a couple shows ago, we are going to be a cleaner community as well. We are going to be better after this. I really firmly believe so. This is the time that shows our character, right? The character of a person. So whatever you could do as an individual, if you're in a position to give. Don't worry about it. It'll come back to you. This is materialistic things. It would always come back, sometimes 5-10 times than you're given, right? If you're in a position to do something, raise funds, to get people together, to bring people together, so collectively we could get some resources and do that. Whatever you could do, whatever talent you have, if you have a voice, you could sing, whatever you could do, you could use that talent to help others. I firmly believe that we are like mango trees. I said that already. We are human beings supposed to be like a mango tree, Dread. Seriously, a mango tree never eats its own mango. A mango tree always bear mango for the benefit and the benefit of others. We have to be like a mango tree. We have to help others. We have to be there for others. And if everybody do this and conceptualize this, we're all going to be stronger because everybody helping each other. We have to be like a mango tree. Tell all of that. Tell all of that.
Do you need?
Yeah, man. We have to be like a mango tree. And listen, Grenada is not the only country that needs assistance. There are people in St. Vincent that we actively been in conversation with, and we went to St. Vincent just a few weeks ago, about a month ago. Got to be on the ground and see what's happening in St. Vincent and the Grenadines. Jamaica, I've been to Jamaica, and Jamaica is having it tough, had it tough as well. There are very low rate of vaccination. People are, there is so much distrust in politics. There is so much distrust amongst people. Right now it's at the boiling point. Kind of have to go back to reality. And love come with trust. There's so much mistrust and distrust. No love, no compassion. Everybody fighting, Jed. The vaccinated fighting the unvaccinated. The white fighting the black. You know, the people who live in houses fighting people living in apartment. Everybody fighting, and this COVID thing make it even worse. You put distrust on top of the separation, you get chaos, man. We had to find a way to come together, man. We had to find a way to come together. There is ways to disagree with somebody's opinion, and don't come out, don't disrespect them. Don't come out in a way. There is some way to bring across your point without disrespecting or degrading another person, right? There is ways to stand up on your ground, stand on your ground, without disrespecting other people. Whether you're vaccinated or unvaccinated, that doesn't put you in a position to disrespect someone who is not on the side of the idea or the ideal that you represent. It's your position, and your position is not a monopoly. Everybody have their position. Everybody have their ideas. Everybody believe in something. I like oil long, you don't like oil long. I ain't gonna kill you because you don't like oil long. You don't like oil long, you don't know what you're missing. Oil long good, eh? But the long and short of it is, I cannot beat you up if you don't like oil long or you don't want to eat it. See your thoughts, that's you how you feel. So they're not bad. They're not bad because they're not on your side. They don't see things how you see it. The unvaccinated people are not bad people. They are people who are not taking the vaccine genuinely because of what they represent. Of what they represent as a people, as a person. Some people don't eat meat, right? Some people live their whole life in this kind of zen, right? I don't know if zen is the right word, but they live their life in a kind of natural way, and that's how they live. It is not something that they could get an excuse from a doctor to say that is their religious belief. So they ain't gonna get no doctor clearance. But they live their life in a certain kind of way. They don't take no antibodies and thing into their body, and they have been placed in a position where it's either they take this vaccine or they lose their job. How could that ever be fair? Some people whole moral, whole attitude, whole life has been being natural, right? No, you want them to change the whole perspective of themselves because the agenda is vaccination. I say vaccine is a good thing. Personally, well, everybody don't have to take the vaccine. The vaccine is not for everybody. There are people who are sick. There are people who are culturally inclined not to be a part of any antibodies or artificial thing going into their body. Somebody said to me, vaccine supposed to be something like so personal. It's supposed to be so personal. It's supposed to be something that it's a personal decision that you make. Just like circumcision. Nobody walk up to you and say, show me your circumcision certificate. Circumcised or not, that is your personal choice. Nobody can mandate you get circumcised. I'm not saying that you shouldn't, guys. Get me right. Get me right. Vaccination is supposed to be somewhat of that decision that a person makes. Get me? Get me? Alright. I said enough. Catch you guys tomorrow. We have a date tomorrow. We're going to be right here, back on the Ride. Don't forget, Ride Along is the platform where everybody have a story to tell. And guys, we have now on the verge of our massive YouTube platform. Massive. 75,000 subscribers on YouTube. Go over there and check it out. Subscribe to us. 75.4 thousand people on our YouTube channel. Yeah, check it out. Click the link. Go over there, subscribe as well. Check it out, subscribe, be a part of our growing large YouTube presence. Big up to the folks on YouTube, man. Big up all you. Big up all you.
Go back on your knees. So when I woke up this morning, I got reason to sing.
Only before I go, everybody had to sing that song with me. I'm blessed, I feel like J Wonder, big up yourself. 107.9, we're live on J Wonder. Big up yourself, J Wonder. So when I woke up this morning, I got feeling to sting. My back, my back, my back. The Messiah, my back, my back, my back. The big man of my back, the back, my back. The Messiah, my back, 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 back. I feel like beating my chest. I feel so I. Nobody know happy like me. I feel so I. Catch you guys tomorrow. Bye-bye.
David Williams Funeral Service serve you with dignity and compassion as you mourn. Every day, we embark on the journey of life, and one day, the journey will end. It's on that day that you can entrust the celebration of life of your loved ones to David Williams Funeral Service. Call 718-291-38.
Feeling hungry, grab a snack. Caribbean food delight. Jamaican patties, light and flaky. Caribbean food delight. Taste the difference. Caribbean food delight. Grab a patty, take a bite. Caribbean food delight. Quick and easy, grab a patty, take a bite. Caribbean food delight.
Oh yeah.
Welcome to TD Bank, where you'll find the personalized attention you deserve and the legendary experience you expect. Let's do business. If you are a medical or dental practitioner, contact me to hear about our tailored lending solutions for residential mortgages, equipment purchases, practice-related commercial mortgages and refinance. Visit me at 500 Baychester Avenue, to hear more about our full range of personal and small business banking solutions. See you soon.